I started to take over your podium. I'm sorry.
You ready?
No, you go ahead. You're first.
Okay. Good afternoon, everybody. Thank you for coming, especially this late on a Friday afternoon. This is a very important issue here in Palm Beach County, so we appreciate all your time. We all know why we're here for this, the deadly fentanyl synthetic opioid crisis here, not just in our state, not just in our area, but nationwide. Florida is fighting back, and with Senator Moody's help, especially, we're trying to make inroads here in combating this terrible crisis. I did not know Senator Moody as a prosecutor, as a judge, but I've known her as an attorney general and now as our newest senator. So I am particularly very, very pleased to have her in Washington, taking the fight that she fought here in Florida so well, taking it nationally for all of us. She's never taken her eye off the ball here. She's probably one of the best multitaskers I've come across. She's able to balance her whole professional life, personal life, and still fight the fight for law enforcement, back the blue and the green, in all the battles that we have. She most recently introduced a new bill to Washington to help first responders, fire rescue, and teachers to be able to afford the first-time homeowners here to be able to purchase homes here in our state. So it's going to attract high-quality first responders here to our state, which is expensive enough to live, but with the help of this bill, we'll be able to attract better quality first responders and teachers here to our area. On behalf of Sheriff Bradshaw, the Palm Beach County Sheriff's Office, and everyone here in Palm Beach County, I'd like to introduce Senator Ashley Moody.
Thank you so much, Steve. Thank you so much, and truly, thank you for being here on a Friday afternoon. This is such an important topic, and we support the tan, too. We back the blue, the green, and the tan. I didn't leave you fellas out. But thank you very much. Mayor Mariano, Mayor of Palm Beach County, we are grateful for your presence, and you've always been so focused on this issue, especially here in Palm Beach County, where this has really been a struggle and a challenge to so many in your county. And I know that your heart is there for the families that you serve. Thank you for being here. I also want to thank Chief John Bonifair, Sheriff Eric Flowers, the CEO of Project Opioid, Alex Price, and many others, so many to name. We're going to have some more speakers from Fire Rescue, but it's really important that we don't lose sight of the deadliest challenge facing Americans right now. So it's oftentimes because we have so much going on, especially as leaders, and all of us in this room, if you're here and you care about this, you are a leader right now in your community. Oftentimes we have so much going on, we have to come back to our greatest threat. And right now, what is killing the most Americans is opioids, and specifically the deadly synthetic drug fentanyl. And while we are seeing glimmers of hope and progress, this still remains by far the greatest challenge to this nation. It also is impacting our children and our teens, many of whom who are taking counterfeit pills, thinking they are Adderall, Xanax, Percocet, whatever, and it's actually a counterfeit pill laced with deadly fentanyl. We lose a classroom's worth of kids every day in this nation to fentanyl poisoning. As a mother of a school-aged kid, as an attorney general, as your newest senator, this cannot keep happening in a nation where we have the tools and resources and organizational efforts and structures to attack it. And so we cannot lose sight. So the fact that we have so many people here on a Friday afternoon gives me hope. I know it does everyone behind me who we've really asked to take on duties that they probably never thought they'd have to take on when they put on that badge for the first time. In many respects, now if you wear a badge, you're saving lives. And it's not just the traditional way we think of, like stepping in, good against evil, standing up for someone who's been victimized. Now you're showing up using naloxone and administering that and saving lives, because we are dealing with an opioid epidemic where it demands such responses. And so I'm so grateful for those that do that and respond. I know here in Palm Beach we have fire rescue that does that every single day, and you're going to hear from Lieutenant Lombardo in just a moment. I want to tell you that in Florida, we have not let up on this. As you know, coming in as Attorney General, this was one of my biggest drivers for becoming the Attorney General, seeing this as a judge for so many years and wanting to be more proactive. And I knew it wouldn't just be a law enforcement approach in terms of fighting this. And I want to commend law enforcement across the state of Florida because they really stepped up. They sent officers to help at the border. They stepped up their enforcement efforts. We had leaders that were willing to push money to extra enforcement efforts. In fact, Florida led the nation in fentanyl seizures. I am so proud of that statistic, and I know that went a long way to our reduction in deaths every year due to fentanyl and opioids because of the aggressive law enforcement efforts here in Florida and because of the support that the legislative leaders and Governor DeSantis gave to law enforcement to help them step up those additional efforts. I want to thank President Trump, who said when he got in office this would be one of his main priorities. We have seen the border secured. I think we are seeing illegal immigration down 93%, and those crossings and that pouring into our country certainly paralleled the pouring of fentanyl into this country. So I want to thank President Trump. As many of you know, 2 years ago, I called for the cartels to be designated as foreign terrorist organizations. I begged and pleaded with the last administration to do that, to make that designation. It did not get done, but thankfully President Trump just did that as soon as he took office. And that is going to go a long way in our additional efforts. But in Florida, we knew it wouldn't just be about law enforcement efforts. We also noted that we needed to expand access to naloxone or Narcan, which is a life-saving drug. And so we've pushed it into the hands of our first responders, as many as we can identify that are willing to take on that responsibility. We've now made it available within drugstores to family members, concerned ones that have someone that are dealing with a dependency. And all of that has gone into decreasing our death rate. And we've also pushed treatment. If you are someone that is addicted to opioids or drugs, it has never been more important than it is right now to get help, because we are seeing fentanyl and fentanyl-related substances laced in every drug imaginable. And so what you may have taken in the past will now kill you. And so if you are someone that struggled, we have partnered with Shatterproof. There is now treatmentatlas.org. You can go search your financial resources, your need. It will tell you where you can go to get help. We've been pushing that to Floridians, and we want to make sure that their families know that is available, because oftentimes it is the families that is suggesting it and pushing it and holding it out as an opportunity when someone needs it the most. So treatmentatlas.org. I advise everyone to get help. It is now more important than ever. Right here in the West Palm Beach Medical Examiner's District, I am proud to announce that in our last available reporting, we saw a stagnation of deaths, a slight increase, but a stagnation. But we still have a lot of work to do within this area. So in this area specifically, it is in the top 3 of number of opioid fentanyl deaths in the state. And that is concerning as we're trying to drive those numbers down. And so we want to make sure, and that's why I'm standing here. I could be standing anywhere in Florida, but I'm standing here because this has historically been an area where we've got to focus attention, and not just money, but attention. I've had some great productive discussions with other partners today on ideas on what we can do to push this message out. We not only need to treat addiction, we need to prevent addiction by educating our children and making sure people know not to take medication out of cabinets and making sure people know not to take drugs that they don't know where they come from, all very important. So we've seen a stagnation, a slight increase here, but still the top 3 in the state. But I'm so proud of Florida in the sense that we have decreased our number of deaths related to fentanyl by 11% here in Florida in our most recent data. And when you compare that to the national average only saw a 2% reduction. So we're figuring out the equation, and we're making progress. And it's because we're not just taking one lane to fight this. We're making sure we're hitting all of our bases, and we're bringing in partners from all sectors, private organizations that are focused on this, law enforcement, fire department, state agencies, and we will continue to do that. I was so proud as Attorney General when we secured a historic recovery against opioid manufacturers, distributors, and pharmacies to help in these efforts. And we're starting to see that recovery pay off. But this is where we need people to not lose drive, not lose focus, because we want to make sure in the areas where we've been hardest hit that we're continuing to keep our foot on the gas, because we're seeing a lot of movement, but we can't slow down now. So as a U.S. Senator, it was not only an honor to be appointed into this role, certainly it's been a whirlwind over the last 2 months, but one of the very first pieces of legislation that I got to fight for and pass out of committee, the Judiciary Committee, was the Halt Fentanyl Act. It schedules fentanyl-related substances, and this is something that law enforcement organizations across our nation, partners, and those affected by fentanyl have been begging for. It's been temporarily scheduled in the past, but this is the first time it will be scheduled federally, and we finally got it out of the Senate committee. I was proud to vote for that. We passed it on the Senate floor by a large majority. And you know how hard it is to get anything done in the Senate. My tactic of persistence is paying off. I've taken it straight from Florida all the way to the Capitol. But now we need the House to take it back up and pass it so that President Trump can sign this as one of the first bills he signs as President of the United States. So I need you and your voices and all the folks behind me to keep championing the message that we must pass the Halt Fentanyl Act. I'm proud of what we've accomplished in the Senate. I'm proud that we were able to get it out, but it does nothing if we can't carry it across the finish line in the House and finally get it for signature in front of the President. So I appreciate you being here today as we together ask for a renewed commitment to fighting the fentanyl crisis right here in Palm Beach, right here in the West Palm Beach Medical Examiner District, where we're wanting to improve those numbers. We want to step up our efforts across Florida to make sure Florida continues to lead by example for the rest of the nation, not only in our actions, but in demonstrated performance. And I ask you and all of Florida to make sure your voices are heard, that the House hears our need here in Florida and across the nation, that it is time, finally, to pass the Halt Fentanyl Act. And thank you so much for joining us. And I am proud to call up Palm Beach County Fire Rescue Lieutenant Lombardo.
Thank you. Good afternoon. Thank you guys for having us here. So first of all, I wanted to thank our partners with PBSO, law enforcement, and our elected officials from local, state, and national party that have our back on this. And the reason why I'm saying this is I feel like I've been doing this for a long time. We've been going to overdoses over and over again, right? But since fentanyl came out, the overdoses that we were faced had rise to a number that we couldn't even keep up. I remember 5-6 years ago, the number of overdoses were the majority of our calls. We were going from call to call, and it was overdoses, and any ages. And we're going from a home to a school. And we found ourselves that we had so many overdoses and all related to fentanyl. And I saw it as we were kind of by ourselves, right? because it's something that we really felt in this field, but not too many were completely aware. And now recently, with the backing that we have from the laws and different partners, and the way we're tackling it as a group, and I feel like we're all sharing this vision. It's like having, your big brothers coming with you to fight and tackle this big monster. So I can tell you, and sisters, sorry, and sisters, you're right, that we're tackling this big monster, and it is, I feel like we're tackling it so easily, and it's helping, and I can see it firsthand. It's helping. How our numbers have decreased, as Senator said, by 11%, but we can see it from the calls that we go to. Okay, and the other part is with Public Health for Rescue, we have this group we call MIH, Mobile Integrated Health, that I'm part of, and another reason that we're able to do that is from the backing that we have had, that we're able to go after calls and meet with these patients that are dealing with fentanyl, right, that have dealing with addictions. And we can reach them at one-on-one, not on an emergency call, but able to talk to them, try to bring them to the other partners that we have around here to go to detox or, medications, help to channel, fight the withdrawals and the want of taking fentanyl. And it's working. I mean, I can see it firsthand, and we have numbers, obviously, too. And it's, I think we're in the right path. I can't say, anything but thank you, everybody's here that, we have this backing. Thank you, Senator. It's making a huge difference, and I'm very, very proud to say that I'm part of it. Thank you again.
Hello, my name is Jim Rao with Families Against Fentanyl. We started this organization in 2017. My son, Tom, was killed in 2015 with a dose of acetylfentanyl sent from the Zhang drug trafficking organization in China. The great work of the investigators traced that poisoning all the way back to the Zhang drug trafficking organization in China. And in 2017, they were indicted, and for the murder of my son, they sent a contingent to the Ministry of Justice in China, where they confronted the Chinese government with this poisoning. They put on a 3-day prosecutorial of the Zhangs, and after 3 minutes of deliberation, they set the Zhangs free, who were later confronted by 60 Minutes, Bob Anderson in the market, and was shown on 60 Minutes, and he said, "What do you say to the parents of these children that you're killing in the United States?" And at that time, he was accosted by the secret police and run out of China. Since then, the growth of fentanyl has become the leading killer of Americans 18 to 45. We did that statistic, Moira Muntz, part of our organization, and at first when that came out, it was denied. But as we continued to press it, we saw that it was far beyond 18 to 45, and the demographic began to expand. Now it's become the leading killer of babies and children through incidental contact. The amount of material that's coming in is indicative of being stockpiled. So they're catching less than 20% according to customs. That amount would kill every person in the United States many times over. A kilo of fentanyl will kill 500,000 people. The actual cost of it would only be maybe $10 for the kilo, because it's based upon petrochemicals that have massive amounts of use in every industry. Aniline is a basic chemical for tons of rubber and plastics. Then we go to something even worse, to carfentanil. Carfentanil, instead of killing 500,000, has the capacity to kill 50 million. This material can be dispersed in the most rudimentary ways, in the air, food, or water supply by using solvents of all different types, and it can also be made to be transdermal. So in looking at this growth of this horror and watching not only my friends and neighbors, but the whole country suffer under this, it's not only draining the will of the people whose hearts have been broken, which is not just the parents, but all their friends and relatives and all the rest of the ancillary damage that it's doing and uncertainty. We're looking at this Halt Fentanyl Act to begin to close the door on this material. I think it'll be an extremely important step forward. So as we're moving forward, we should be pushing this as hard as possible. We should know that this material has the potential to kill every one of us. The amount that they're seizing would kill everyone in the United States, and that's only 10%, so it's obviously being stockpiled here. There's no other mathematical equation that I can come to other than it's being stockpiled in strategic areas so it could be deployed in mass casualty events to destabilize the country. So this Halt Fentanyl Act will be an extremely good step of raising this awareness, pushing this agenda forward, and stopping what could be the worst disaster in American history. So I thank you all very much.
Thank you. In speaking with Mr. Rao, CEO Price, so many families across this state, what has driven many people to start doing more in this space and advocating and trying to come up with solutions and being a part of the solution has been their own personal loss of a son or a daughter or a mother. It's the destruction that it has had on the American family cannot be overstated. And so I'm grateful for you being here. I'm hoping that everyone watching knows that getting fentanyl-related substances and fentanyl scheduled through the Halt Fentanyl Act is incredibly important. It has been at the precipice of passing for a long, long time, and it needs to pass now. And so I thank you for being here and giving attention to this crisis and to the loss that so many have faced around this nation and what we can do to stop that from happening to other families now. I'd be happy to take any questions.
Can you explain, please, what is the Halt Fentanyl Act? What is it composed of?
Yes, thank you. And this is a really interesting setup. You can see us. There's all these lights on us, but you are in the complete dark, so I cannot see your face. But I'm just going to answer this voice that I see in the corner over here. The Halt Fentanyl Act schedules, so makes illegal and sets out penalties for fentanyl and most specifically fentanyl-related substances. So what was happening is the chemical compounds of the stuff that was pouring into this country, again originating in China, coming through Mexico, and then smuggled into our country by the cartels. Each substance might have a different chemical makeup. And so it was making very, very hard when it was determined that someone died of a fentanyl-related substance to get that prosecution and that specific penalty, because fentanyl-related substances that would be the catch-all for all of that, even the slight changes in chemistry, those were not scheduled. And so a lot of what we're seeing, our children especially across the nation, die of, and what I personally heard testimony from in Washington during committee were parents that lost children who had taken a pill that they got from a social media app, and it would be this chemical compound, totally illicit, but this will make it easier to go after those poison peddlers, those traffickers of these chemical substances, once we can get it permanently scheduled.
And what are the federal penalties now for, you're saying these are components that are used to make fentanyl, or these are chemicals that already contain fentanyl?
They're already the substance that mimics fentanyl. So it schedules fentanyl and fentanyl-related substances. Those substances mimic the chemical compound of fentanyl. Depending on the amount would affect the penalties. Of course, we will get you those based the specific amounts and those penalties. But I can tell you, as a former federal prosecutor who went after drug traffickers many times, those penalties are based on the amount of drugs. I want to take a moment too and commend our now Attorney General Pam Bondi, former Florida Attorney General Pam Bondi. It is legend in Tallahassee when we started seeing this drug in our communities. That she was going around the Capitol with a vial and a very, very 2 small grains of sand to show people what it would take to kill someone, pushing to get this scheduled. And it shows the passion that she had at the time and still has to go after those that are seeking to do Americans harm. And so I'm excited to be now in Washington pushing as a senator to give her, as Attorney General, the tools that she needs to make this country safer, that the president needs to make this country safer. And I think that I know that this will go a long way to helping us accomplish that.
What do you think our viewers need to do to see that this pass?
Would you mind repeating that?
What do you think the viewers who will be seeing this news conference, what do you want to tell them that they need to do to see this pass?
Yeah, if you are someone that cares about this issue and you can't have been alive in the last decade and not been touched by this in some way, a family member, a friend, a coworker, this is the time. We are at our best chance of getting this passed right now in Congress. If people will call their House members, call the Speaker's office, encourage them to bring it up, make sure that it passes so that we can get it over to the President's desk as soon as possible. I am so proud of the efforts that we have done here in Florida. I'm so proud that we didn't just focus on trafficking and efforts in terms of law enforcement efforts, that we also complemented that with naloxone, pushing it into the communities and getting treatment to those currently addicted. It has to be a three-front approach. But we have to, in order to meet the moment in terms of our law enforcement efforts, we have to pass this act and get this scheduled federally. And so my ask would be to make sure that your representatives and your senators in Florida, you've got the senators covered. I know that Senator Scott agrees with me, and I'm in his ear all the time about it. He cares about this issue very much. But we need to call the representatives in Washington and make sure they know this is important to Americans. This is the number one deadliest issue facing Americans' health right now. You heard the statistic on how it's affecting our babies and children in terms of incidental contact. It is so important. Let's get it scheduled. Any other questions?
When you say we need to get it scheduled, I'm not sure I follow exactly. What does that mean?
So, any substance that is an illicit substance, a drug, has a schedule. I don't want to get too much into the details. I don't know if your viewers will appreciate it. Of course, I can do that with you separately, but there are different schedules. So you'll have a Schedule 1 drug, a Schedule 2 drug, a Schedule 3 drug. That's how it's federally scheduled in federal statutes. And that would tell you what penalties are assigned to that particular drug. And it's based on its effect on the community, on the human body, its danger, its whether it's medically used. There's all kinds of factors that go into that. But the way something is scheduled is how it's prosecuted and what the penalties are associated with that. So, and that applies to any drug that you would throw out there that you would probably know of, whether that's methamphetamine, cocaine, I could go on and on. So this just gets fentanyl scheduled so that we can the cases and prosecutorial efforts are easy to accomplish.
Last question, please.
Any other questions? Yes, ma'am.
My niece committed suicide 4 years ago. My sister. Over and over. It's very hard on the family, especially on my sister that witnesses. The person that sold her the fentanyl got 3 years. And that's such a concern for me because that's not enough. So how can we change that? Because I feel that they go in and they come out and they're not really getting penalized that aggressively.
Well, first let me just say I'm so sorry for your loss. I'm personally met with folks around this nation that have lost loved ones, and I'm very sorry. It drives me and inspires me, and I know it drives everybody up here in the professions that they have chosen to do, and thank you for that. Is to help families that are might go through something like yours, prevent that from happening again. I was just in a hearing dealing with the elder population and opioids and how it affected the elder population. And what struck me was that when we lose someone in a family, it's not just children that suffer. If it's a mother or father, the grandparents' lives are forever changed. They are now called upon at an older age. Often they're struggling physically. They are definitely not in a position in their lives where they thought that they would be caring for young children. It has placed a lot of strain and resources on extended families. And so when you talk about your extended family and the loss that you felt, I think that we're feeling the dynamics of this crisis in ways that we don't always immediately recognize. And I do understand there is this drive for justice, for vindication when we lose someone. And quite frankly, that's what we all want up here, is to bring justice and closure to those that have suffered from crime. And the Halt Fentanyl Act is seeking to help with the prosecutions of what I call poison peddlers. We have to put traffickers behind bars. We have to hold them accountable for what they are doing. And if they are peddling fentanyl, that is the most deadly drug. Carfentanil is another synthetic opioid like that, but these drugs are lethal in very, very small amounts. It's the most dangerous drug we have seen as in our nation's history. That is why we are losing hundreds and thousands of Americans to this drug. And so this will help with those efforts. This will help us bring justice to those that have lost loved ones to traffickers. And what you see coming out of DOJ and out of the White House right now, all around the nation, they feel that drive to bring justice to those that have lost loved ones. And we want to help them do that by giving them this tool. Thank you so much for being here. Appreciate it.